is Monica Manginsai, and I am a Term 2 nursing student in Professor Sink's class, and I am going to be demonstrating IV insertion. First, I would check my doctor's order, check labs, and verify the reason for the IV so that I can inform the patient. I would gather my supplies. When I enter the room, I'm going to perform hand hygiene, provide for privacy, verify the patient's name and date of birth before I discuss any sensitive medical information with them. I'm also going to check their chart for allergies and ask the patient to verify if they have any allergies, especially a latex allergy. Then I am going to begin with my supplies, getting ready to do the IV insertion. I have my saline flush. I'm going to be applying my clean gloves. I have tape, my IV catheter, and my IV start kit, along with alcohol swabs or ChloraPrep wipes. First thing I'm going to do is I'm going to prime my IV line. And once it's primed, then I will clamp it off and set it aside. I'm going to assess the patient's arm. I'm going to make sure that the patient has not had a mastectomy on this side. They don't have any ports, bruises, or open wounds. The IV should always be started at the most distal vein first. In case you have to move it, you can move it proximal later. So I'm going to apply the tourniquet 4 to 6 inches above the site. That I expect to insert the IV, and ask the patient to squeeze their hand to pump up the veins. Palpate for a good vein. And take my alcohol wipe and clean the site in a circular motion outwards up to 2 inches. Stabilize the vein with my non-dominant hand and go in at a 10 to 30 degree angle, making sure that the catheter does not touch the thumb of my non-dominant hand that's stabilizing the vein. And I'm going to warn the patient they're going to feel a stick. Once I have flashback, I'm going to advance the catheter forward while pulling the stylet out. Pop the tourniquet. Quickly apply the IV. Then I'm going to open the clamp. Aspirate for blood return, and then use the push-pause method to flush the vein to verify patency and placement. And I will clamp it off sure that all of our sharps go in the sharp box. I will apply the Tegaderm. Outer paper. In real life, if all that paper was left on the Tegaderm, then I would get a new one. But I'm going to initial, date, time, and write the gauge and the length of the catheter on the label. And apply the label. And I would also have a piece of tape so that I can stabilize the line. I would check the patient, make sure they are okay. I'm going to document the gauge and length of the IV, whether it's intermittent or whether it has a continuous flow to it. The location of the IV, which is in the right forearm, how the patient tolerated it, and the number of tries that I used to get the IV in. I would clean up everything and dispose of my gloves. And to show you my IV site, let's see if I can find my IV site. There it is.